Hello, my name is Changseok Kang and I work at Gyeongsang National University Hospital. Let me briefly explain the paper that will be published in Investigative and Clinical Urology in January 2024. The prevalence of a clinical BPH varies considerably across country and depends on the composition of the population studies, the definition of BPH, the selection criteria, and the method of use. Most epidemiologic studies are the results of a person size, IPSS, and PSA, a readily available specific region, and insufficient number of participants. So we analyzed the big data of the Korean Prostate and Boiling Health Association to find out the prevalence of LUTS BPH. The Korean Prostate and Boiling Health Association is comprised of urology professor and nurse who wish to volunteer and provides education and university hospital level treatment to patients suffering from urinary disorder. The Korean Prostate Boiling Health Association directly visits all regions of Korea and conducted free community care for prostate and survey for 20 years from 2001 to 2022. General men who voluntarily wanted a free prostate examination after 1 week of publicity in the implementation area with local government public health center were targeted. It was conducted at least 11 times and up to 29 times a year, and a minimum of 27 men and maximum of 1,149 men were screened per trial. A total of 72,870 men have been inspected, and among them, 72,068 men aged 50 years or older were included. IPSS subscore were investigated on 52,448 subjects. TRUST was conducted on 54,200 patients. PSA was performed on 71,133 people, and uropolmetry with a urine test was performed on 70,080 people. In the uropolmetry results, the cases were where the total urine volume was less than 150 milliliter were excluded. The average age was about 75 years. This figure shows prostate size according to age. Mean prostate size was 24.7 gram for those in their 50s, 27.7 gram for those in their 60s, 31 gram for those in their 70s, and 33.7 gram for those over 7 years of age, showing a statistically significant increase in prostate size with age. Figure 2. The proportion of histology BPH greater than 30 gram was 21.6% in the 50s, 32.7% in the 60s, 42.5% in the 70s, and 48.5% in those over 80 years of age. In all men, it was 40.6%. The proportion of large clinical BPH greater than 80 gram was 0.1% in the 50s, 0.4% in the 60s, 1.5% in the 70s, and 2.85% in those over 80 years of age. In all men, it was 1.5%. The figure shows prostate-specific antigen level according age. Mean PSA was 1 nanogram per millimeter in the 50s, 1.3 nanogram in the 60s, 1.9 nanogram in the 70s, 2.3 nanogram in the 80 and older, with statistically significant increasing in PSA with increasing age. The proportion of high PSA greater than 3 nanogram was 3.8% in the 50s, 70.7% in 60, 13.1% in the 70s, and 17.9% in 80 years of age or older. In all men, it was 13.1%. This figure shows IPSS according to age. The mean IPSS total score was 10.7 in the 50s, 12.7 in the 60, 14.5 in the 70, and 16 in those over 80 years old, and the IPS total score increased statistically significantly with increasing age. IPSS avoiding surgery and quality of life scores also increased statistically significantly with increasing age. The proportion of moderate symptoms was 48.9% for those in their 50s, 52.1% for those in their 60s, 52.8% for those in their 70s, and 50.8% for those over 8 years of age. It was 51.7% of all men over 50 years of age. The proportion of IPSS total score of severe symptom was 12.5% in the 50s, 19.2% in the 60s, 25.8% in the 70s, and 32.4% in 80 and older. It was 27.30% of all men over 50 years of age. As per discomfort according to IPSS, incomplete emptying of and precancy were the most uncomfortable symptom in the 50 and 60, but incomplete emptying and nocturia was the most uncomfortable symptom in the 70 and 80 and older. Nocturia had the lowest score on 7 questions of IPSS in the 50s, but the highest score increased with age. This figure shows peak urine flow rate by age. Mean Qmax was 20 mm per sec in the 50s, 70 mm per sec in the 60s, 15 mm per sec in the 70s, 13 mm per sec in those over 8 years old, and Qmax decreased significantly with increasing age. The proportion of Qmax below 15 ml per sec was 30 in the 50, 40% in the 60, 54% in the 70, and 65% in the 80 or older. In all men, it was 53%. The proportion of Qmax below 10 ml per sec was 4.8% in the 50, 11% in the 60, 70% in the 70, 25% in the 80 or older. In all men, it was 70%. Mean urine volume was 304 ml in their 50s, 302 ml in their 60s, 286 ml in their 70s, and 260 ml in those over 80 years of age, showing a significant decrease in urine volume with age. The proportion of urine volume below 200 ml was 25% in the 50, 23% in the 60, 28% in the 70, 34% in the 80 or older. In all men, it was 29%. According to our research, incomplete emptying was the most uncomfortable LUTS BPH symptom in all age groups. Additionally, nocturia is the most sensitive symptom related to age. In the 50 and 60, the frequency was the second most uncomfortable symptom and nocturia was the lowest discomfort. However, in the 70 and 80 and overs, nocturia was the second most uncomfortable symptom. Therefore, nocturia is not a big problem in people in their 50s, but as age increased, discomfort increasing the most. The mean PSA in this study was also significantly increased with age. The high PSA rates in this study was somewhat higher than the result of a previous study analyzing Korean NHS data, which may be related to lower overall PSA rate compared to Western country. Unlike previous study using NHS data or multicenter data, our study included not only patients but also many general men who did not visit the hospital. We believe that this difference in inclusion criteria is the reason for the different result from previous published study. Lastly, this study targeted voluntary participants from general men and in the community. It was not possible to exclude all participants with a history of being diagnosed with or undergoing treatment for prostate cancer among them. Therefore, some limitation must be taken into account when interpreting PSA data. Thank you.